We are truly honored to have Dr. Alok Roy sir with us, a highly respected academician, administrator, and clinician in the field of Ayurveda with us. I welcome you, sir. Moving ahead with speaker's introduction, today's speaker, Dr. Alok Roy sir, a distinguished scholar with over 22 years of experience in practice of pure Ayurveda. He has completed his BAMS from Ashwini Ayurveda Medical College, Davangere, and pursued his post-graduation from Bharati Vidyapeeth College of Ayurveda, Pune. Currently, he serves as professor and HOD in the Department of Basic Principles, Academic Dean, and Principal of Sushrata Ayurveda Medical College and Hospital, Bengaluru. In addition to his academic leadership, he is also a treasurer of Vishwa Ayurveda Parishad, Karnataka State, a Board of Studies member at Mandsauri University, Madhya Pradesh, and managing director of Puriya's Earth Ayurveda Multispeciality Center, Bengaluru. Alok Sir's vast experience in teaching, administration, and clinical practice makes him a true pillar of Ayurvedic education and healthcare. We are extremely fortunate to learn from such an accomplished personality today. I take a pleasure to welcome Dr. Alok Roy sir for enlightening us with his valuable insights. I hand over the session to you, sir.
Thanks, Ms. Anusha, for giving a very lively, pleasant introduction. So, I welcome all the students who are into this live streaming, and I hope the syllabus is a revision of Padarth Vijnana paper 1 and 2, which creates a little bit tension among all the students in first year. It will help for them to overcome the pressure. You see, Padarth Vijnana paper 1 and 2 is almost 100, 200 marks paper, and you have to score 50, 100 marks total in theory. So the thing is, you have to learn smartly and study smartly and write smartly. That is the key of this medical education. And I hope this kind of syllabus revision. I have taken certain topics limitedly because it's very difficult to cover in one session. But I have tried my maximum best by seeing the recent question papers of Rajiv Gandhi University. So yeah, I hope it will help them to understand and learn better and write the exam in a proper way. So moving on to the next slide, first you have to understand the uh, questions, because see, don't start your answer just straight away. You have to wait, you have to read the questions properly, understand the question, and then you can write. Now, there is a long answer question of 10 marks each. So there are totally four questions in both in paper one and paper two I'm talking. So almost 40 marks for this particular questions. Now 40 marks out of 100 marks. Now what I observe is that they spend more than 2 hours in writing this long answer question, but I don't think so that much time has to be spent. I think so 1.5 hours is maximum you have to give to write all the four long answer questions. And there are 5 pages allotted as per the Rajiv Gandhi University format for writing the answers, which should be enough so that it should cover all the points of the related topic. You have to understand that. So first, the four long answer question is of 10 marks, and already the NCSM has allotted a syllabus and chapter as per from which chapter the 10 marks question should come. So that also I will highlight in the next slide. Now next comes the short answer questions, 8 marks, 5 marks, 8 questions. So for example, now this 5 marks, 8 questions, almost 40 marks. So this has to be is scattered from the different parts of the chapter where you will be getting all those questions. And of course, there are 20 MCQ questions, and most of the students will write in last 5 to 10 minutes. Don't make mistake, don't overwrite. Sometimes examiner may not give marks for overwriting. Okay, it's upon the discretion. So you have to write both with numbers as well as in words also, as per the Rajiv Gandhi University format. So we'll move to the next slide. First, you have to understand from which chapter the long answer questions will come. As you know that Padarth Vijnana syllabus is very limited. It is not as vast as Sharirachana or Sharir Kriya or Ashtangridaya, Samhita Dhyana. And most of the questions are repeated, and it is known to everybody what kind of questions will be coming. For example, we have four long answer questions in PV1, and the chapters which has been allotted by NCISM is first chapter, that is Ayurveda Nirupana, second chapter Ayurveda and Darshana, third chapter Dravya, fourth chapter Guna, fifth chapter Karma, Samanya and Vishesha, where long answer questions will come from this seventh chapter. Each one chapter, one questions. For example, what kind of question can come from the Dravya chapter? So here there is one illustration here. Explain Dravya, its Lakshana, Vargikarana, and importance in Chikitsa. So such kind of questions will be coming from that chapter, and most of the questions are repeated if you see the previous examinations, and there is just a little bit changes in the wordings, but answers remain the same. Next question is a very common question. Usually, oftenly, it is asked in RGS exam, like explain the Samanya Siddhanta and its importance in Ayurveda. They may rephrase this question with other words, but the answers remain the same. You need to get panic. You have to know the answers. Now, another question from the second chapter: explain the philosophical backgrounds of fundamentals of Ayurveda. That is nothing but the Darshana and Ayurveda, how it is independent and how we have got lot of basic information from the Darshana. Next, another question, Guna. Of course, Guna, more than 25 marks are allotted for this chapter. One long answer question is compulsory from this chapter. Usually they ask bit like explain Guna and Paradi Gunas, etc. and all those things. Or maybe they can ask Vaisheshik Gunas. But that will deal when that particular topic will come. Next comes the karma and its utility in Ayurveda, where a question directly from karma may come. You have to explain. Another sixth question, what example I has given, it is from the Dravya chapter. Like explain Padmamata theory and its importance in Ayurveda. Most of the questions will be based on the utility, how you have understood the importance of those chapter in Ayurveda. So this is just a general introduction about the long answer questions. In the following slides, I'll be taking few long answer questions so that you can understand about how it is going to be proper. So next slide, please. I think so. It is about short answers. Now, you have to understand short answers are also 40 marks, 5 marks for each short notes, and most of the students will lose your marks. Here, if you don't write proper and complete answers, you get 2 marks, 3 marks, which is very bad to pass. So you have to score at least 4 to 3 marks for all the questions so that you can pass in this exam. Now, which are the general questions in PV1 for short answer? This is general, like Anyona Pravesha Siddhanta. Anyona Pravesha Siddhanta is nothing but how Panchamahabhutas Utpatti has taken place. It is also called as Panchikarana Siddhanta. So, in short notes questions, this kind of questions will be asked. Now, Mano, Guna, and Karma. Now, Manas is very important chapter. Definitely, one question comes from this chapter, and usually uh, these two questions are very common, like Mano, Guna, and Karma, and Mano Annamayatva. Mano Annamayatva is nothing but the Panchabhautik nature of the Manas and the Indriyas. So, usually, of these two questions, such kind of questions will be coming for short notes. And of course, Atma. Atma, one chapter is there where it is not included in 10 marks, but included in short note question. So, on short note question like Atma Lakshana, Vedas, etc. And of course, another compulsory question comes from Abhava chapter. Again, definition, types, and utility, all those things are there. Sixth is Adhar, Adeya, Sambandha, which is nothing but Samvaya. Samvaya is the sixth Padartha. So, usually, a short note question comes from that chapter also. Now, like something different questions which I have to explain here is seventh is pravrutti ubhayastu. What is pravrutti ubhayastu? Pravrutti ubhayastu is nothing but the utility of samanya vishesha in Ayurveda. If you see, this is the last word of the Charakokta Shat Padartha Shloka, where it explains the importance of the samanya vishesha siddhanta in both ways, how we can use it in chikitsa. So such kind of typical questions with typical wordings may also come. So don't need to get panic. It is nothing but the utility of Samanya Vishesha. Next is again from Gunas, as I told you. Gunas 25 marks question is there. One long answer question is compulsory. So another 15 marks comes from MCQs and short notes like Vaisheshik Gunas. These are nothing but the Shabda, Sparsha, Rupa, Rasadamda. Or typically they may ask Gurvadi Gunas like Pischila Vishada or two combination Gunas. So like that the questions will be asked. Next is Sankhya Darshana and Ayurveda. from Darshnik chapter, where any Darshana in Ayurveda, Yoga Darshana in Ayurveda, usually they ask the first four Darshana, Vaisheshik, Nyaya, Sankhya, and Yoga. Other two Darshanas are very limited influence to Ayurveda, so it is not usually asked. But these are the four Darshana where they have a certain relation, certain contribution. So they may ask about that. Again, another one, explain Ichha Dvesha. These are part of Adhyatmic Gunas, which are six in number. So that can also can be asked for short note question. Then again, of course, Mahabhutas, Agni Mahabhuta and its significance, where you have to write the definitions, types of Agni Mahabhuta, and its importance. So like that, usually the short answer questions of PV1 is asked. Once you understand this question paper format, again, here I have missed the Kala and Disha also. So usually one compulsory question is from Kala also. So Kala will be asked, and most of the time, the questions are very fixed in the PV1 as well as PV2. So from that each chapter, you have to study that specific answer and you have to write it. So that's that much easy it is. We'll go to the next slide, please. Yeah. Now this is about the PV2. Now PV2 is also 100 marks. Again, you have to understand the long answer questions. Now PV2 syllabus is more limited than PV1, and hence usually most of the questions are repeated. Now the chapter from where the long answer question may come is from 1, 2, 3, 4, and 7, not 5 and 6, which is Yukti and Upamana. So usually from these five chapters, only four wrong answer question is coming. One is compulsory from Karyakara Siddhanta. Before also it was compulsory. In new syllabus also it is compulsory. So one question compulsory comes from Karyakarana Siddhanta. And another one question also can come from Anuman Pariksha, which we have seen from last 2, 3 times. Anuman Gamya Bhavas are asked repeatedly. So that is nothing but the utility of Anumana. Then Pratyaksha Pariksha, one question, long answer question, and Aptopdesh Pariksha in the first chapter, general introduction of Pariksha and Pramana. So usually the long answer questions will be coming, and out of these five, one question each from each chapter you have to understand will be definitely asked for the long answer question, that is 4 into 10, 40 marks. So what kind of questions they may ask? See here, I've given a sample of question papers. For example, define and explain Karya Karana and write the significance of Karya Karana Siddhanta in Ayurveda. Usually, this is the general question, either in the form of general Karya Karana Siddhanta and different Vadas or Satkarya Vada. So usually these two questions will be coming from this particular chapter. It is compulsory comes. Now define Anumana, its type and explain Hetva Bhasa. So many students get frightened with the Hetva Bhasa. It's easy. If it's easy, just you have to understand the tables, etc. It will become easy to write also. So the Hetva Bhasa can come for 10 marks also. Another 10 marks question which can come from Anumana is utility of Anumana, which is nothing but the Anuman Gamya Bhavas. Okay, they may ask these questions with the different wordings, but answers remains the same. Now, from the first chapter, what is the question? Only one probable question is there. What is Chartur with Pariksha, and explain its importance in Ayurveda. So here you have to explain in general about the Pariksha, importance of Pariksha, and the types of Pariksha, Chaturveda Pariksha. Now, what are the Lakshanas on Karyakarna? As I told you from the last chapter of Karyakarna Vada, the Satkarya Vada. This kind of questions can be asked for 10 marks. Usually it is asked of that. Now, usually another questions from Pratyaksh Pramana, enumerate Pramana, and other darshanas, etc. also can be asked for 10 marks. And of course, from the Aptopdesha and write down the Apta Purusha Lakshanas and its utility. So these are the usually the general 10 marks question, where the out of seven, if you see four usually will be asked in this particular pattern. The next slide, please. And what may be the short answer questions in different PV2, like Indriyartha Shanikarsha Beda from Pratyaksha chapter, Pratyaksha Anuplabdhi Karanas, Shabda Vritti, Yukti Pariksha. Now, Yukti Pariksha and Anuman Pariksha, which are missed in long answer question, will definitely be asked in short answers. Because Yukti Pariksha is told in Ayurveda exclusively by Charaka, so it is not going to get missed. It is going to definitely be asked for 5 mark short note question. And again, next is explain Sadrusha with example. It's nothing but about the Upman Pariksha. Upmans are Upman Pramana. Now, this is nothing but, again, an important chapter where they are missed for 10 marks question. So definitely is going to be asked in short note question. Now, again, other short note questions where the 10 marks are missed, for example, Aptopdesha Pariksha is there. where a lot of short note questions are there, like Shabda Bodhakruti, Vakyartha Jnanetu, Shakti Graha, and Apta Purusha Lakshanas. If it is not asked in 10 marks, so usually they ask from the Apta Udesh Pariksha, different two or three short notes. And of course, Anumana Pramana is also there, where the different short note questions are there, like Vyapti is there, Tarka is there, then Sadhetu Lakshanas are there, and all those things. Even Panchavivya Vakya is there, or Pararthanumana is there. So this kind of short notes can come. And from the Karya Karana Vada, different types of Vada, Pilupaka, Pitarpaka, then Sabhava Upram Vada. So like that, the important Anekanta Vada can be asked for short note questions. And from Pratyaksha Pariksha, Pratyaksha Anuplabdhi Bhava, Vidyartha Sanikarsha Veda, Trayadasha Karna. Trayadasha Karna has come one time for 10 marks recently, we have seen. Though it's a short note question, but it has been asked for 10 marks. So there you have to elaborate about little bit about the Indriyas and Karanas in particular in that kind of answers. Now again, define Paksha, Sapaksha, Vipaksha. This is from the Anuman Pariksha. So where the different parts of Anuman Pariksha is asked here. Arthapatti Pramana, short note questions from the other Pramanas. We are studying only six Pramanas, but other four small in that Arthapatti is important, where the famous example of Ayurveda tells that curd should not be taken in night time, but it also means it can be taken in daytime. So understanding that. So that is nothing but Arthapatti Pramana. We'll talk about now in detail about the other topics. Next slide, please. Now, this I've given a small format for PV1, a long answer question. Now, such kind of sometimes the students will get confused if they ask a big question for 10 marks because they have to complete the answers in the particular pattern of 10 mark. So how you are going to cover those concepts? For example, this had come long time before in old syllabus, but it created trouble to the students. What was the question? Explain the utilities of Padartha for a 10 marks question. Now, the Padarthas are six in number. The utilities of all the six Padarthas, you have to write it. It's a very long, maybe 5 pages are not sufficient. But you have to understand, you have to add and cover the points in such way that everything is touched and it has been written completely. For example, how we try to divide the marks in this kind of uh, questions. For example, definition of Padartha with Lakshana 1 mark. Padartha Sankhya is nothing but the Shak Padartha, 1 mark. Utility of Samanya Padartha, 1 mark. Utility of Vishesh Padartha, 1 mark. Utility of Guna Padartha, 2 marks, because Guna is very vast and very important. Utility of Dravya, 2 marks. Utility of Karma, 1 mark. And utility of Samvaya Padartha, 1 mark. So like that, we try to divide the marks. And if you're able to cover all these points, you will be given full marks. If you are touching only 1 or 2 points, what happens? Usually the student will lose marks. So what I've seen is that out of 10, they get 3, 4, 3, 4, like that. So for that reason, you have to touch everything with minimum whatever this page which has been given. So it's a smart question. You have to answer in a smarter way. So it comes in the paper one. So we'll go to the next slide. What is the body of this question? So again, of course, the first thing, introduction, just 1 or 2 lines you write. Padartha, what is Padartha? Padartha is very much important. Okay. So Astitva, Abhidheyatva, Neyatva, three gunas of qualities of Padartha, it should be their definition. And afterwards, directly go for Veda. So Charaka Shloka, very famous. Chamane cha Vishesham cha Gunan Dravyani Karmacha Samvaya cha Tat Knyatva Tantra Uktam Vidhim Astitaha. So again, this is the Padartha Vedas. You have to write all the six. For the PPT, I have just written the shloka, but in detail, you have to write in detail. So one below one. First is Samanya Padartha, second is Vishesha, third is Guna, fourth is Dravya, then fifth is Karma, and sixth is Sambhaya. Please write the sequence properly. Don't write Dravya Guna Karma Samana Vishesha, because those should padarthas as per the Vaisheshik. But we have to stick on to the Ayurveda, that is Charkokta. First always starts with the Samana and Vishesha. Now, so if you, since this kind of question has come, now utility of Samana Vishesha. So what is this utility? So you have to write the importance of Samana Vishesha. No need to explain in detail. If you start explaining in detail about Samana Vishesha, you may lose time and you may not give justice to the other questions. Go directly to the answer. So such kind of question requires direct answer. No need to explain them because they ask directly the utility. So instead of start explaining about Samana Vishesha, please go to the Samana Vishesha utility. So what is that utility? We use this concept in treatment. Okay, increasing and decreasing. So this is the part of questions, part of chikitsa, elevation, aggravation, vitiation. So these are the fundamental treatment principles which we use. Next slide, please. So we use this Samana Vishesha Siddhanta in Ayurveda. For example, I've given here if there is Mamsakshaya, we give Mamsa for Vruddhi. If there is Shukrakshaya, we give Shira. Shira is different because of its guna. The Shukra Vruddhi takes place. So that instead of going in detail about Samana Vishesha, I have just written the few examples of the types of Samana Vishesha in Ayurveda. That is what is required in this kind of question because the answer is very vast. Go for the utility directly. Next slide, please. So again, if you see the guna now of Ayurveda. Now, what is guna? Now we are using there are 41 gunas. Now just mention those 41 gunas. Don't write about those gunas because you don't have that much time to write it. Go directly for utility. Now, if you see the treatment in Charaka is divided basically into two categories. One is Panchkarma, that is Shodhana. Second is Langana, that is Shamana Chikitsa. Now, what is Shamana Chikitsa? So, Ashtanga Hridaya has given types of Shamana Chikitsa, what we call as Shat Upkrama, like Brumana, Snehana, Stambhana, Langana, Rukshna, Svedana. So, this Shat Upkrama is nothing but the application of Guna principles in treatment aspect. Okay. For example, Brahmana. Now, what is Guru? Guru Guna as Brahmana Karma. So, if a particular person requires Brahmana, so we give Masha. If a particular person needs Snena because his body is very Ruksha, we give Gruta, Tela, etc. So, this is nothing but the application of Guna. So, you have to write in general where we use this Guna for treatment principles. Okay. So, this is nothing but about the Guna. Next slide, please. Next is again about Dravya. Now, what is Dravya? So, again, Dravya is very vast. We cannot write all the Nava Karana Dravyas importance. Okay, so we have to explain in detail. The in very first chapter, Charaka explained the three types of Dravya, which itself is the utility. He tells there are only three types of dravya. One is kinchit docha prachamaka, that is, for example, madhu, which does kapha shamana, kinchit dhatu pradushaka, like viruddhara does tridochushana, and kinchit swasthya hitkara, which is shashtika shalik, it has to be taken daily for swasthya. So, such kind of divisions explain the utility of dravya in Ayurveda. Okay. So for that reason, you have to understand instead of writing each by each, we have a timing shortage, which explains the utility of Ayurveda. So such kind of the minimal presentation is needed. Similarly, simultaneously, karma. Now, karma is also very much important in Ayurveda. So we use a lot of karma, like Panch karma is there, Vamana, Virechana, Anuvasana, Astapana, etc. So those are the treatment applications in Ayurveda. In Shastra Karma, we use Ashtavida Shastra Karma, Agni Karma, Shara Karma, Chedana, Vedana. So all those things comes under the importance and utilities of karma. Next slide, please. Now, Samvaya. Samvaya is like a pratak guna, which is Adhar Adheya. So like Bhumi with Gandha guna. So this is very much important. If any guna is not inherent in that particular dravya, then we cannot use it. So that's why it is on rational basis we use Samvaya because this concept is very important. And hence, in this way, we have to present such a complicated questions where they have asked whole paper one, Pradhan paper one in 5 pages. So this is a gist of all the such kind of questions, how to deal with this kind of questions where the portion is vast and you have a limited time and pages. So this is the way you have to write this 10 marks question. Next slide, please. We'll go for the another 10 marks question. I'll be taking RGHS recent RS7 batch questions. So for example, this question has come in July 2024, RS7 batch, the new batch of the NCISM. So what was the question? So here a 10 marks question has been asked. Define Dravya, write its classification and explain its utility in Ayurveda. Now it has come for 10 marks. So as a evaluator, how we try to divide the marking system. So first or we have to we divide by the marks. For example, introduction of Dravya, that is 1 mark. Definition of Dravya, that is Dravya Lakshana, 1 mark. Classification of Dravya, 4 mark. Utility in Ayurveda, 2 plus 2 mark. That I will explain, and I will explain this thing. Now you have to understand, I am going directly to the question. So many students will write offbeat the answers. Answers will be going beyond the questions. That's why I'm telling you, have to try to understand the question. Here specifically it has been given. It consists 3 parts of question: definition, classification, utility. So we'll be what will be the answer for this kind of question? We'll be seeing the next slide, please. So here the introduction. Introduction, you have to understand Dravya is the fourth Padartha among the Shat Padartha. For example, the Charaka already told Samanacha Vishesha Gunam, Dravyani Karmacha, Samvacha Tatmyatu, Tatrokta Vidhimastita. So it is one of the fourth Padartha. Of course, Samana Vishesh is the first two. So it also has its important. It is one among the Chatushpada also, always remember. Bishak Dravya Rogi Pada Upasta. So Dravya is also one among the Chatushpada, and so it is very much important. In Vaisheshika, it is told as first Padartha, but in Ayurveda, Charaka told it as a fourth Padartha. Next slide, please. So this is the introduction of the Dravya. It's optional. If you want to write 1 or 2 lines, that is fine. We will go directly to the answer. Definition. So what is the definition? In which guna and karma existed in with Sambha Sambandha is called Dravya. Very famous shloka. Don't write any other shloka of Darshana. Charaka shloka is very important. Yatrashita karma guna karanam samvai yat tat dravyam. So everybody knows this shloka from Charaka Sutrasthana, first chapter. Already it is explained in Samhita Dhyana also. So this shloka is very much important. If you read this shloka along with this meaning, you get 1 or 2 marks clearly. Now classification. Now Charaka has classified Dravya into 2 categories. First is Karandravya, second is Karyadravya. Next slide, please. Karandravyas are 9 in number, Karyadravyas are innumerable in number. So all Karandravyas are Panchmahabhutas, and the other 4 thing, that is Kal, Dik, Atma and Manas. So this is the 9 Karandravyas. Karandravyas are innumerable. They can be further classified into, we have to draw a table. Since this is a very vast question, you have to draw tables, figures wherever necessary, because this will highlight your marks. Next slide, please. If you see in the next slide, this is based on the PPT presentation. Everybody knows this classification. The table has to be drawn. The Karyadravya has been classified into Chetana, Achetana. Chetana is also called as Sendriya. Achetana is also called as Nidendriya. Again, Chetana is divided into Antaschetana, Bahishchetana. Examples are very much important in Padartha Vijnana, my dear students. You have to know this. Wherever if you write like Vanaspati, Vanaspati example is Vata. Vata, not Vata, it is Vata. It is uh, the Bengal tree, which is ficus tree. Okay, so that Vata is that, and Vanaspati, that is Amra, where we can see the flowering. Okay, the mango tree. Oshada, that is Goduma, that is also called as wheat. Then Viruddha, that is Kuruchi. So like that, examples are very much necessary. You can draw the table. Below that, you can write the examples, or write it neatly in paper so that it can be identified. Examples, wherever it is possible for PV, has to be written. If you don't write, your marks will be cut definitely. And so that's why this is what the classification looks like. Next slide, please. Now coming back to the utility. Now utility is also, as I told you, 2 plus 2, 4 marks. Now this, we have to concise a whole year chapter of Dravya in utility. So what is this utility? So first we'll try to concise ourselves. So utility of Navakarana Dravyas, 2 marks. Panchmamutas, Atma Manas, the Kal is there. So you have to write the importance and utility, how it is playing an important, like Panchmamutas are structural dimension in physical bird. Our body is also of Panchmahabhutas. So you have to write those particular important thing. Any vikara placed in Panchabhautik Sharira can be corrected only by Panchabhautik Dravyas. Again, second is Kala. Kala, Atma, Manas, and Disha. They are outside things, but they are also Dravya. So how Kala plays an important role in the form of administration of medicine, collection of medicine, it has been documented, as well as identifying the disease in various stages. We identify the disease in Shat Kriya Kala, Prathamavastha, Sanchaya, Prakopa, then Prasaravastha, like that, Sthana, Shamshraya, Bhedavastha. So these are nothing but the application of Kala. Now, what is the importance of Atma? Atma is the driving force of human system. Without it is impossible to think about the treatment. You have to know it is the essence of that Atma. We are all alive, so definitely it plays an important role. Next slide, please. Now, Manas is also very much important. If you see it, are most of the diseases nowadays are having a mental dimensions also. So proper functioning of the Manas is also necessary for overall normal function of the body, and of course transformation of messages in human body and a treatment expert, etc. And all those things can be done through this manas. So this is about the Karyadravyas. Now the Karyadravyas, as I told you, Karyadravya classification which we have seen is the classification of Darshana. Okay. Now, and little bit of Charaka also. Here, Charaka also gave another classification of Karyadravya, which is again going back to same thing. Kinchita dosha prachamana, kinchit dhatu pradoshaka, kinchit swastha hitkara, which is nothing but the classification of all the drugs has been classified by their profound role in their body, how it is going to do body changes. So that we have seen in this kind of divisions, which will explain the utility of Karyadravyas also. So this is how we have to write our 10 marks question for the Dravya. This is a general common answer. You can always add and subtract. This is just one guidance for how to write the answers for your answer. Next slide, please. Another question have taken a long question from RS7 July batch as a yeah, define Samanya Vishesha, write their classification in detail and utility, of course. Now, this is a very common question, comes across the 10 marks. It can be independently asked for 2 marks, two questions. Samanya 5 marks question, Vishesha 5 marks question. So whatever it is, answers remain the same. You have to understand. So now this is a question from RGHS RS7 batch. Again, we have to understand, you have to start all the 10 marks question with an introduction. A small introduction is easy for the reflection of your answers. So introduction, Samanya definition with shloka, Samanya classification with examples, Vishesha definition with shloka, Vishesha classification with examples, then importance application of Samanya Siddhanta and Ayurveda. Next slide, please. Now I will be going very fast because everybody knows about the. I'll just tell you how you to write the answer. Now, Samanya definition, introduction. Definitely, as I told you, Samanya Vishesh Siddhanta is the first two Padartha of Ayurveda, and it makes a very important thing in our Ayurveda. So again, Samanya definition, Sarvada Sarva Bhavanam, Samanya Vriddhi Karanam, Samanya Ekatva Tulyartam, Samanyam Vriddhi Samane Sharvesham. So like that, this definition will be has to be written, and the explanation for this definition has to be given. Next slide, please. Then Samanya Bhedas are there. Now, I have not written here examples. Please write examples for Dravya, someone like Mamsa. Mamsa will increase Mamsa. So like that, you have to write examples of all these types of Samanya as well as Vishesha. It is very much important. Just write examples for Bhavruti Samanya, Ekruti Samanya, Dravya Vishesha, Guna Vishesha, Karma. Next slide, please. Now, importance of Samana Vishesha Siddhanta in Ayurveda. You have to understand that Mamsakshaya, Gugulu, usage of Gugulu, Vyayama, Staulya, which is very much important in Prameya. And all those things, see, many treatment aspects are based on the Samana Vishesha Siddhanta. Actually, all treatment. For example, if any Vruddhi is there, we have to do Shapana. Shapana means decrease the doshas, etc., or dhatus by the opposite treatment. Okay, and we should know the reasons also why the Samana philosophy. So, like that, we have to use this wisely, the application of Samana Vishesha. So, here I've just given some points how we use it in treatment aspects and all the in a very better way. So in this way, we have to write the answers of Samana Vishesha in Ayurveda, where different examples has been given about the answers. Yes. Next slide, please. Now, another question, very common question. What are the Charkokta gunas? Explain Paradi gunas in detail. It has come in August 23 RKHS RS7 for 10 marks question. And as I told you, Guna chapter compulsory one 10 mark question is there. So for again, you have to write the Guna definitions and all those things. So word Guna has come from Guna Amantrane. Okay, so because of qualities we like one dravya. So that is very much important. And of course, the Guna definition as per the Charaka is Samvai to Nichest Karanam Guna, which is in Samvai Karana but without any karma, is that is called as Guna. So in a dravya, which is in Samvaya Sambandha, but is without Cheshta, that is called as Guna. So here Guna is again Suchitin Dravya. It is not an action, it is a cause. So how we try to define the Guna. Next slide, please. Now, Charkokta are 41 gunas. Always remember Charkokta, Chakrapani, both are. Chakrapani is the commentator for Charaka. So, if they ask Charkokta or if they ask according to Chakrapani, whatever it is, answers remain the same. It is 41 gunas. Vaisheshik gunas are 5 in number. They are Shabda Sparsha, Rupa Rasa Gandha. Sharirik are 20 Guruvadis gunas, Guru Lagu, Snigdha Ruksha, etc. etc. So, these are the 20 Guruvadi gunas. And Paradi Samanya gunas. There are 10 para, apara, yukti, abhyasa, samskara, prathakatva. All those comes under the paradi gunas. Adhyatmic gunas are 6 in number. Icha, dvesha, sukha, dukkha, ahankara. So those are the adhyatmic gunas. We have to know buddhi. They are the adhyatmic 6 gunas. So they asked the classification of the 41 gunas. So you have to write in detail one line. As for the PPT, I have written the shortened version, but you have to write in small short. Now, in this particular matter, I'm pointing out the Ashtang Sangra also. So please understand, Ashtang Sangra is also from Ayurveda. Sometimes they may ask question. So explain Ashtang Sangra gunas. Or in MCQs, they can ask Nimitta gunas. Which are the Nimitta gunas? So you have to understand, Ashtang Sangra has told 5 gunas extra along with Charaka. So 41 plus 5. So 5 gunas he has told. Which are those 5 gunas? So everybody knows about those things. Sattva, Rajas, Tamas. They are the Mahagunas, what we call as Mahagunas. And they are associated with the starting from the Shushti Utpattikrama. And next two is Dharma and Adharma. So Ashtanga has added, Vagbhata has added Dharma and Adharma. And that dharma and adharma is called as nimitta gunas. Okay, so probable MCQ question can be asked, but this is just an extra for the information purpose. I have posted here in the classification of gunas. Other than that, Vaisheshik has told 17 gunas, Nyadarshana has told 24 gunas. Originally, Vaisheshik has told 17, but Prashasta Pad Bhas, who is a commentator for the Vaisheshik, he told 24. So 24 of Nyaya and Nyaya Darshana and Vaishik is same, but usually it is not asked in the new syllabus. We'll be concentrating only on Charkokta as well as maybe more maximum and little bit for Ashtanga. Next slide, please. Now, Paradi Gunas is a very common question in exam for short note as well as long answer question. So here Paradi Gunas, I have just written a shortened version. You have to write 1 or 2 line explanation, and also don't forget to write examples. Okay, examples are very important in all the gunas, and you have to write Ayurvedic examples. Don't write Darsenic examples. For example, para, apara. Para is the best one. Apara is the least one. For example, if you see we in Ashtanga, we studied that desha. Desha of 3 types. So in that, which desha is the best? So Jangal Desha is the best, which is also called as dry area, where trees are very less, water is less, but it is very much, we can stay for longer duration because that is para according to Ayurveda. Apara is Anupadesha, where a lot of trees are there, a lot of green is there. It's more of marshy places. So this is a place where a lot of infections, infestations happen. So that is apara, the least one. Now, Yukti is planning again chikitsa, planning of Panchkarma treatment. If any patient is coming, you plan a treatment, you do yojana. Yuktischa yojana. You do yojana of treatment. You will give some medicines right now. After 1 week, you may change the medicine. So this is very much important quality of a very good physician. So that's why Yukti, if you see, exclusively told only in our Ayurveda. So Yukti is that. Sankhya is again number, three dosha, sapta dhatus, again three phala, panchavalkala. So numbers. Why they have told? Because to know the drugs, to know the doshas more better and to understand. Samugya is combination. Combination, as I told you, we combine many drugs like triphala is there, one of the best combination. So what is this triphala? It is nothing but combination of ablaki, vibhidaki, haritaki, that is samyoga. Vibhaga, separation. We try to separate the unwanted materials from a proper drug lot. For example, like we purchase a vegetable. When we go to purchase a vegetable in the market, we remove the unwanted things. So that is called as vibhaga and take the better quality. So this is about the paradi gunas. Next slide, please. Now, Pratakata is nothing but distinctness. Now, if you see, every drug is having its own identity. Haritaki is of five varieties. Each variety of Haritaki is having its own unique identity, that is Pratakatva, and its importance. If you see if you are very much keen to use a proper Haritaki, you can go for that also. So that is nothing but one of the quality. That is Pratakatva. Parimana is nothing but the measurement. Measurement is very important. We have Charaka Vimanasthana, measurement, giving the drugs, giving the dosage of the medicines for children, for adults, for pregnant. You have to know. So that is parimana. Samskara is a transformation. We transform the poisons to a medicine. How? Through samskara. Like parada is definitely a poison, but by Ashtavida samskara, we convert into a medical potency. Abhyasa, another one guna, exclusively told by Ayurveda, by Charaka, that is repetition. Abhyasa of Sashtika Shali, Amlaki is very much beneficial. Anything, something has to be repeatedly taken for the proper benefits. So Abhyasa and Yukti, these two gunas are very much important and practical gunas explained Paradi gunas by Charaka, and it has very much importance in practice also. So this is how we have to write and explain about Paradi Gunas with examples. Of course, very important. If you write all these points which I mentioned in this PPT, you will get 8 to 9 marks. So sure. If you know the shloka, please write the shloka also, like Yuktistu Yojana and all wherever it is. You know, like about the different types of Paradi Gunas. Next slide, please. Now coming to the paper two. Now paper two is also, as I told you, limited chapters. More often questions are repeated. So for example, here what is Chaturved Pariksha? Explaining the importance of Ayurveda. But a similar question came. As I told you, question rephrasing can be done, but no need to get confused, my dear students. You have to understand that it is answers remains the same. So your similar question has come. Define pariksha, explain the importance using pramana along with examples. RGHS 2024 July RS7. Questions will change, rephrase, answers remain the same. So how we try to divide this thing? So it's a 10 marks question. So introduction, definition of pariksha and pramana 2 mark, pariksha bheda. That is, since it is pariksha, we have to write Chaturvid pariksha only because Charaka told only 4 types of pariksha. Then importance of pariksha pramana, importance of again all the four, because it's a long answer question. You have to write all these 10 marks accordingly. Next slide, please. So how we go ahead? First, introduction. Now, introduction pramana is very important. Paper 2 consists of pramana pariksha. They are the means and instruments to acquire the knowledge. Pramana is a word which is used for pramana in Ayurveda. We don't use word pramana, but we use word pariksha. So that's why pariksha, because Charaka explained it in a very practical way. Parikshayati vyavasthapiyati vastu sarupam anyati pariksha. Means examining the things in orderly. Orderly means you have to observe the object in all the direction in a proper systematic way. Okay, so this is nothing but what we call a scientific way. A very beautiful explanation has been given. Now, pariksha was used by Charaka, and it was used in two places. So here in Sutrasthana, Charaka used pariksha to prove the existence of Punarjanma. It is explained in Triyeshni Adhyaya, where he first time explained the 4 types of pariksha, that is Aptobdesha, Pratyaksha, Anumana, and Yukti. So this is the 4 basic classification of pariksha. We have to stick on to this pariksha only. No need to write all the 10 pramanas. Here the question is asked about pariksha. So you have to stick on to this question and stick on to the same answer. Next slide, please. Now, what is the importance of Pariksha and Pramana, etc.? See here, the knowledge is of two categories. One is scientific and one is general knowledge. What is scientific knowledge? What is general knowledge? I've given many times example to my student. For example, if a child is having a fever, so mother knows my child is having a fever. So this is what we call as general knowledge. But the same child will be taken to a doctor. He will record the fever. Record the fever means he'll do examine the fever. He'll do pariksha. So by doing examination, he will give a scientific explanation. For example, he'll record the fever by the thermometer. So we will see whether the fever is what degree, 100 degree, 100, 1, 2, 3, 4, depending upon the instrument. So this kind of knowledge, what he gets, it is called as scientific knowledge. So pratipatti jnana means scientific knowledge. So scientific knowledge is the main aim of pariksha. So we examine the people and patient and we try to measure everything in a scientific way. So that is the most important benefit of application of pariksha in Ayurveda. So that is what we should know and highlight those things. Now every pariksha is very much important, but here I have highlighted only few importance. Now since the answer is very vast, you have to limit to few. So example has been given. For example, importance of Aptopdesh Pariksha. So Charak has given 10 points. Always remember, try to read and understand in point system. So Charak has given 10 points in this. But I've here written only three. Prakopa, Yoni, Utthana, Samsthana, Bheda, all those things are explained the 10 points because we have to cover the other three also. So Prakopa, so Snigdha Ruksha Karana, why the Prakopa has happened. Yoni, from where the involvement, the source of the doshas. So all those things can be explained in Aptopdesh Pariksha, Utthana, mode of manifestation of the disease. Next slide, please. Next is you have to go in the sequence, please. First is Aptopdesha, second is Pratyaksha. Now, Pratyaksha is also very much important because the first time we see a patient, we do Pratyaksha. Aptopdesha is done at the hospital bedside where the doctors will explain how the disease, like Utthana, manifestation, etc., to the students. The next is the Pratyaksha when the student himself uh, sees through his all four indriyas except Rasandriya, then what we have to see? We see the color, shape, measurement, complexion, the different types of sounds produced, the different body parts. So all those things, then we touch it, we feel the tenderness and all the varieties of pain, roughness, etc., as well as the smell from the body and other things. So these are the application of utility of pratyaksha. Next slide, please. Now, utility of Anumana. Anumana is very much important. Independent, it can be asked for 10 marks. As I told you, several times it has been asked Anumana Gamya Bhavas, 10 marks. So almost there are 24 Anuman Gamya Bhavas as per Charaka. You have I have written only 8 because we don't have that much time to write it because we are covering all the parikshas. So for example, how we can know Agni? We cannot see Agni. So we can know through the power of digestion. We cannot see the strength of the person. So how we can know? Hanumana, by doing the power of to do exercise. So like this, we have to do Anumana. So Charaka has already given 24 examples of Anumana, Gamya Bhavas. So of that few which I have written here can be seen in this particular Anuman Gamya Bhavas. Next slide, please. Next is Yukti Pariksha. So Yukti Pariksha is also, as I told you, told exclusively by Charaka. So first he told Yukti in Chaturvid Pariksha and Sutrasthana. Later he converted Yukti into Anumana in the Vimanasthana. But why Yukti is told? So Charaka told Yukti for proving the Punarjanma in drug research. Drug research means what, for example? If you want to make a combination, so if you want to make a new combination, so you try to collect the drugs which are having similar properties and remove the what do you say, the drugs which may counteract the main network. So this is nothing but your yukti. It's about the wisdom of the physician. So that is called as drug research yukti. Experimental. So again, if you see experimental knowledge, We have to always try to experiment something new. Oh, okay, let us give this drug and see what happens. This is again in diagnosis. Definitely in diagnosis, upashaya, samprapti. You have to use your intelligence because diagnosis is very confusing. So sometimes we have to use different other factors also to understand the diagnosis. Yukti is nothing but consideration of Bahukarana Yoga Jnana, means multiple factors. So you have to use those multiple factors. So sometimes your diagnosis cannot be done by your Pratyaksha, Anumana, etc. We have to send for investigations, MRI, laboratory investigations, etc. Again, when we try to get after getting that investigations, we consider those points also, your physical findings also, clinical findings also, and then we come to a diagnosis. This is nothing but Bahukaran Yogjana for the application of Yukti Preksha in practice. So this is the way how we have to write this kind of questions for 10 marks. Next slide, please. Now, as I told you, Karya Karana Vada, every time, not even this new syllabus, old syllabus also, one compulsory 10 marks question has come. So here one question has come, Karya Karana Bheda, and explains Satkarya Vada in detail. It has come in March 25, RS7. So usually this kind of 10 marks question, we try to divide Karana Lakshana 1 mark, Karana Bheda 2 marks, Karya Lakshana 1 mark, Satkarya Vada 2 marks, importance of Satkarya Vada 4 marks. So next slide, please. We'll go to the Karana Lakshana. Now, what is Karana? Definitely shlokas has not been this PPT, but your everybody, wherever the specific shlokas are there, please refer the textbook to write a shloka like introduction, Karana Lakshana. Okay. So the Karanavada is one of the important chapter which explains, which provides the theoretical background for most of the principles of Ayurveda, especially in Charaka Samhita. So again, Karya and Karana, both are the two parts. So every Darshana has its own way of telling the Karya Karana Vada. And usually we stick on to Satkarya Vada because Charaka believes Satkarya Vada is very important. So again, Karana Veda, Samvai Karana, there are three types of Karana: Samvai Karana, Asamvai Karana, and Nimitta Karana. So here Samvai Karana is nothing but the Upadan Karana. Here the thread is the reason for the Pata. Next slide, please. Asamvai is not opposite of Samvai. Please don't get confused. This is a specific. For example, red color thread produces red color cloth. So this is specific. And nimitta is the external cause. External cause means the person who is bringing all the threads, the weaver, to make a cloth. Okay. So that is nothing but the three types of karana. Then karya lakshana, it is the effect or the not as per the the Dashvit Pariksha Bhava, karya, karana. So the normalcy of the dosha to produce the treatment effect is nothing but called as karya. It is the end product of the karana. So this is about the karya karana. Next slide, please. Now, Satkaryavada. Now, Satkaryavada is again, as I told you, a very common question. It is divided into two parts. One is Parinamavada, told by the Sankhya Darshana, Vivartabada, told by the Vedanta Darshana. So, what is the difference? Satkaryavada, definitely, it is that the active principles of a drug will be present in that drug. It has to be brought to the to bring that potency. So that's why what they say is that Karya resides in Karana in an invisible form, okay, unmanifested state, but it has to be bought in a manifested state. So that is nothing but the relation between the Karana and Karya. So Sat Karyavada, Sat from Sat, Sat is produced. So this is nothing but about the Sat Karyavada, accepted both by Sankhya as well as Vedanta. But we use the Parinamavada that is explained by Sankhya for our practice or understanding the physiological aspects of many things. Next slide, please. There are 5 points in Satkaryavada. You should know Asat Akaranat, Upadan Garanat, Sarva Sambhava Bhavat, Shakta Shakya Karanat, and Karana Bhavat. So these are the 5 points with examples. You have to write it for any kind of Satkaryavada question in the exam. Next slide, please. Next comes the utility of the Satkaryavada. Now we use it for Dhatu Utpatti like Shir, Dadinya, etc. Vipaka, Parinamavada, what we talk about Vipaka, then Sroto Utpatti. All these are the basically the utilities of the Parinamavada or the Satkaryavada in Ayurveda. So if you write this thing, you get 2-3 marks in this particular answer. Next slide, please. Now, few short notes question I have taken. I have taken from paper 2 also, paper 1 also. So first we'll go for paper two. Now Tarka, such kind of question comes in PV2, Tarka, for 5 months. Nowadays, what is this Tarka? Though is the Tarka is a part of Aprama, but it is very much important in Anumana. We say that Anuman Nama Tarko Yukti Pekshaha. Tarka is nothing but an argument. Okay, it's a type of Tarka. You'll get more description in the textbook. So it's an argument. It is very useful. For example, if you open a TV at 9 o'clock, there is a debate, a political debate happens in television where everybody is debating. This, that, those are called as Tarka. Okay. But political debate does not have any ending, and we are not in political debate, we are in the scientific debate. In scientific debate, tarka is very much important to accept universally, for getting acceptance universally. So there are very much important. So those are the part of aprama which is used in anumana to fulfill and make the concepts more clear. A very much important concept can come for 5 mark short note. So this is a few, if you see, about the tarka. Next slide, please. And then again, since it comes for 5 mark, you should know. So you should fulfill at least, there is 3 pages allotted for 5 marks. So you should talk about Tarka. So if you see in the 2 pages slide, I think so it's enough. Or you can add, of course, you can also add, of course, for the 5 marks question. Next slide, please. Now, another one question which I have seen often, it has come for PV2. PV2, we are discussing right now, PV2 short answer questions. Prarthanumana. Prarthanumana for 5 mark. It is also called as Pancha Avyavya Vakya. Pancha Avyavya Vakya is nothing but how we transfer from knowledge from one person to another person. Anuman. So there are 5 steps for that. The first step is pratigya, second is hetu, drishtanta, then there is upnayana, then nigamana. So this is the way how we see. This is for the PPT. I have made it short. You have to write it in 2 or 3 pages. So you have to write it in a proper way with proper example. And if you know the shlokas, you can write that also. Okay. So this is the way how you have to write in proper thing, point to point, so that you get more better marks. Next slide, please. Next slide also explains about the Upnaya and the Nigamana. Okay, Upnaya is nothing but the application of Vyapti, and Nigamana is nothing but the conclusion or restatement of the Pratigya, restatement of the your statement. So this is how we talk about Pararthanumana and Panchavyavya Vakya. Next slide, please. Okay, coming back to paper one. I have come back to again paper one. For short note questions. Now, as I told you, Disha, Kala, Atma, Manas. 4 chapters are there. Sorry, 4 sub-chapters of Dravya chapter, where every time a short note question is coming. Because since these chapters are important, but they are not that much important to be asked for 10 marks question. So definitely they are going to be asked for 5 mark short note question. Like here, Disha, they ask a question, Disha, they carry significant. They may rephrase a question from that chapter, whatever it is. First, you have to write the definition. The definition is Prachi Adi Vyavahara Heturdik. The definition is from Tarka Sangra. Charaka does not explain about Disha in like that, in that way. So you rely on Tarka Sangra Shloka. Prachi Vyavahar Prachi Adi Vyavahara Heturdik. Sa cha eko Vibhu Nitya cha. Means it is only one, and Vibhu and Nitya. Though it is only one, but in Ayurveda, we take it into consideration, because whatever we are studying on the aspect of Ayurvedic or utility of Ayurveda examples. So first is direction, second is place, region, dosha. Desha, sorry. So what is this direction? Direction is from where, for example, if you see uh, from which part this particular item has come. For example, we say that kesar is the saffron. It comes from Iran also, it comes from Kashmir also, but the Kashmir saffron is the best, they say. Like that, many things, region specific, they are considered the best. So because of the active principles which are found in them. Okay. So direction is very much important. Again, place, region, desha. Again, place means, for example, we are studying anatomy. What is anatomy? Anatomy is nothing but location. The liver is situated in the right hypochondriac region. So this is nothing but the sense of the direction or disha. So where it is situated, what place it is situated. So this is the application of the disha. So these examples are very much important. You have to know, and so that examples has to be written in the short note. Next slide, please. So first the definition, then types, and then examples. So like here, desha is of three types. So direction, which where it is, specific direction. Then again, Charaka, and in the later Ayurveda books, they told how to construct a hospital, in which place, which things should be situated, and all those things. Again, if you are going to expose to a wind, or how the specific wind has certain action in your body, so those things has been told about the importance in health consideration in the Ayurveda. So which has to be written in the significance and importance in Disha. Next slide, please. Okay. Now another one very very common question which I seen every time it is coming: definition of Ayurveda. Students find it difficult. Only one shloka is there, but how you have to write for 5 marks? So you have to understand 5 mark is three pages are allotted. Of course, everybody knows the shloka. Hita hitam sukham dukkam aistasya hita hitam manam chatancha yatraktam ayurvedam sa vichyate. Science that deal with measurement. Manam means what? Measurement. Measurement of life. Hitayu, ahitayu, sukha and dukkha is called Ayurveda. So that also you have to write. In another question context, Charaka in Sutrasthana 30th chapter, he explained in more detail about the definition of Ayurveda. So if you know this shloka, it's very well and good. If not, write the meaning of the shloka for 5 marks, because here action of Ayurveda is explained directly for 5 marks. Next slide, please. What it explains. So here, Swalakshanata. So what is this? So here I have given you the point system. If you remember this shloka, well and good. If not, at least remember these points. Science which is self-sufficient. Swalakshanata. Ayurveda is self-sufficient, having its own ideology, gives the knowledge of Dravya Guna Karma, which have effect on the following factors. Now, Shat Padarthas are very much important. Always understand Shat Padartha is the base of Charaka. So we are studying all these Dravya Guna Karma, which affects your Sukhayu, Asukhayu, Hitayu, Hitayu, Prama. Pramana means how much, Apramana, Ayushya, Anayushya is called Ayurveda. A very beautiful shloka. If you write all these two things description, you will get 5 to 5 or 4 marks, depending upon the presence of shloka or not. Next slide, please. Now, Guna and Karma of Manas, which I have seen many times, it has come for short note question. As I told you, Manas is very important chapter, but it is not allotted for 10. Definitely one short note question will come for Manas. So which are these questions? Usually, Guna Karma of Manas, Mano Vishaya, or Guna of Manas, like that. So here, Mano Gunas is been asked. Anuttam Chayakadam Dwa Guno Manas. Always remember you have to write Charkokta Gunas only, don't write Darshani Gunas. Anuttam, Ekattam are the two qualities of the Manas. And always write in point system, mark wherever it is possible, underline where it is possible. How we can prove Anutva and Ekatva? Again by two Nyayas. Utpala Shatpatra Nyaya, Alata Chakradarshana Nyaya. You can write discussion about these two Nyaya also. I have just given here hint. You have to write in more detail in the exam, in at least 4 lines about this different Nyaya. Next slide, please. Then comes the karma of manas. Students get confused between karma of manas and mano vishaya. Mano vishaya, chinta, vichara, uya, deya, sankalpa. They are the vishaya. But karma is three. Indriya nigraha, swayam nigraha, buddhi pravartana. So shloka is directly from Charaka. Indriya vigraha, karma manassa, swasya nigraha, uhiyo, vicharasya tatam, param buddhi pravartate. Buddhi pravartana. So three karmas of manas is there. Indriya nigraha, Swanigra. Swanigra means self-control. And Buddhi Pravartana is the action or the karma of the manas. So you have to write again in detail about those things in a short note question. Next slide, please. As I told you, Kala is also very much important chapter. It is missed in long answer question. Definitely asked in short note question. So out of 8, I'm telling definitely from Kala one question, Manas one question, Atma one question, will be definitely asked. And Abhava. Abhava also is asked. So most of the questions are repeated. Please study wisely. It's very easy to pass PV. So here, Akadu Charaka, Kala means transformation. Shloka is very much important. Kala Puna Parinama. Here I have not written the shloka, but it is Kala Puna Parinama means transformation. And according to Chara, Kala is only one. But for our convenience sake, we divide two based on our Ayurveda. Don't write Darshnik. So according to Charaka, classified Kala is classified into two types, Nitya and Avastika. Okay, what is Nitya? The Nitya is same for everyone. It's the season. Season is same for all the people. Okay, Rutu Samvatsaradi, like we study about the Shad Rutus. Like now Vasant Rutu is going on. Vasant, then Grishma, then Varsha, then Sharad Rutu, then Hemanta, Shishira. So these six Rutus, Rutu Samvatsaradi, Dakshinayana, Uttarayana. Okay, so this all this Rutu is Nitya, Nitya for everyone. Means it is constant for all the people. That's why it is called as Nitya Kala. It is uniform and constant. Next is Avastik Kala. Now person to person, the Avastik Kala is there. Every person is having a different age group. My age this much, your age this much. So like that. If any particular person is having a disease, so we'll be classifying the disease stage, Avastika Kala. So that is called as Avastika Kala. So Nityaka Kala and Avastika Kala, they are the two types of the Kala. Next slide, please. Next is the utility of the Kala. What is utility? There are many utilities of Kala. I've highlighted only two. So here, for example, in Dosha Vadyavastha, we try to identify any disease in different stages. So this stage, Shat Kriya Kala, is explained by Sushruta very beautifully. So we try to understand the disease in six different stages. In Pratama Kriya Kala, Dvitiya, Samchaya, Prakopa, Prasarana, Sthana Samshraya, Vyadi and Bhedavastha. So we try to identify the disease in different stages so that the intervention and treatment can be given accordingly. In Sanchaya, we can do little bit upvasa or rasa, upyoga of rasa. In advanced state of Bhedavastha, you may require surgical treatment, you may require different intervention treatment. So based on the avastha of the disease, Shat Kriya Kala is very much important. So that is about the Doshvadi avastha. Next, right, please. Next is Aushad Grahana Kala. Now, our Ayurveda medicines will be prescribed, and we have to give the Kala also. For example, certain Kashayas require before food, certain Asavarishtas after food, certain Churnas, certain Kashayas has to be taken in empty stomach, sometimes along with the meals, and all those things. So, Ashtanga Hridaya has told 10 Kalas, like in empty stomach before meals, like Apan Vayu, if the patient is having a Apan Vayu problem, the medicine should be taken before food. If the patient is having the problem of Prana Vayu or Udana Vayu, so Muhur, it has been taken frequently. You're having cough, cold, so you have to take medicine every 2-3 hours. Okay, so like that, based on this thing, we administer the medicine based on the Kala, based on the requirement. So this is also one of the important utility of Kala. There are many utilities. This is also one dimension of Kala in Ayurveda. Next slide, please. Now coming back to the paper two, I have come back to the paper two. Yukti, as I told you, Yukti Pariksha is very much important since this is not asked for 10 marks question. What question is compulsory coming from Yukti Pariksha for 5 mark? That is blind, I can say. Out of 8 question, one comes from Yukti. So usually what it comes? Application, utility, types. No, there is no type actually, examples and all. So first you have to write the definition. Okay. So definition and what is the specific characteristic of the Yukti is Bahukaran Yogajan. Bahukarana Yogana means multiple factors is the essence of the Yukti. And Yuktis three kalaha. We can know the three kala. We can know the three past, all the three tenses of any patient just by application of Yukti. Okay, so now how Yukti was utilized? So already I have given in the before slide also to prove Panarjanma. Next slide, please. In drug research, experimental evidence, and in diagnosis. Same thing has been repeated here. So if it is missed in 10 marks question, definitely a short note question will come. And sometimes questions will be repeated. Don't hesitate to write the repeated answers. because it's possible that if it is asked in a 10 marks question may come for again short note also. Don't hesitate. You have to rewrite it again. Maybe the framework of the question we have to understand that, and based on that we have to rephrase it and write the answer. The same thing here. Already Yukti has been told if a Chaturvid Pariksha is asked in a 10 marks question, again you have to write in if this question is coming from Yukti Pramana. Next slide, please. Explain Samanatva Drushta. Now, this is a typical question. If you see, Samanatva Drushta is nothing but Upman Pramana. It is explained by Nyaya. Though Charaka did not explain as a pramana or pariksha, he is explained as a quality or guna. So what is upmana? It is nothing but samanyata dushta, similarities. Pramana based on similarities, comparison, what we call as comparison. So here example has been given about Gavaya, Nilgai to the normal cow which is found. So how to know Gavaya or Nilgai? Just you have to go and similarities by based on the similarities we try to assess. So this is about the Upmana. Next slide, please. Now Nyaya Darshana has told about the types of Upmana. So Sadharma Upmana, comparing of unknown to known. Vaidharma Upmana, knowledge gained of comparison by dissimilarities. And Dharmano Manatto Upmana, recognition by specific character. So these are the three types of Upmana Pramana. And how it is utility anatomical concept. Now, Hridaya is compared to Pundarika, Bhasha, Kilaka. So all these are names have been given. Now, Tamaka Shasa has sound like Kapota, warbling of Kapota, how the person will breathe. So that specific sound will come, pathological concept. Shukra is compared to Spatika, Arthur is compared to the Shashasruka. So like that utility is there where we try to compare known to unknown or unknown to known so that we can understand the things more better. Next slide, please. Next slide, please. I think so.
Sir,
This is the last. Yeah, yeah.
yes,
So this, yeah. So this is just one few examples of I can add more and more because since it is a small presentation and inspiration for our students to understand how to write the answers. Okay. So this was just a, I don't want to go teaching all the syllabus. This is how you have to write the answers before the exams. No need to get panic, my dear students. And you have to understand the questions writing point system so that you can get more better marks. So this PPT and other session is for you to train. You can also add extra whatever you learned from your different colleges or your textbooks, and of course increase the quality of the answer. Just this is just a general guideline for how to write in PV1 and PV2 exams. I hope it will be clear and it will inspire the younger generations to understand the PV more better and write and perform in the exam more better.
thank you, sir. Thank you so much. I think our students might reach us later with the questions, and we will get back to you, sir.
Yes. Thank you. It
And
will be a great honor to host such an inspiration video for everyone. Thank you, Team Jigyasa and Pancha Janya for inviting me for to such an occasion. Thank you.
thank you, sir. I also extend my heartfelt gratitude to you, sir, for accepting our invite and making your time and sharing such a valuable knowledge and experience with us. It was really a enlightening session, and your words have truly enriched our understanding, and it's a boost for students appearing for exams, sir. Thank you so much, sir.
Thank you.
Thank you, sir. And I hope let us carry forward the knowledge gained and implemented in our academic journey, and we are excited to learn more from you, sir.
Okay. Thank you.
Thank you, sir.